So, happy International Education Week, everyone, and welcome to this session where we're going to be talking about global health career insights from the MS degree perspective. This is a session that Education USA Mexico is organizing. I'm organizing this in collaboration with my colleagues Mabel Martinez from Guadalajara at UDG and Jenny Diaz from Mérida. My name is Edith Melendez, and I'm the Education USA advisor for San Luis Potosí and Querétaro. So welcome, and we hope you find this panel pretty informative and that you can discover new options for you in the health area. Having said so, and before we start and go with the amazing panel that we have today from the University of Notre Dame, I'm going to share with you a little bit about Education USA. For the ones that don't know a lot about ourselves, Education USA is a global network of advising centers from the US State Department. That means that we are sponsored by the US government, and we're here to provide accurate, comprehensive, and current information about higher education institutions in the United States. So you can come to us to ask any questions about any university in the United States, and we will be very happy to help you find out real and, as I already mentioned, comprehensive and current information. All of the services that we offer are for free. We offer different services that can be online or in person. We have different centers around the country. We are more than 20 centers in Mexico, so you can go to our social media and you can ask to talk directly with the advisor that is closest to your area, and we will be helping you into finding the way to go to the United States to study. In order to do that, we follow a framework of 5 steps. These are the 5 steps that we use to advise you to help you during this process. The first step is to research your options. Probably you don't know that there are more than 4,000 universities in the United States, so it's kind of complicated to get to know which one is the best fit for you. So we help you, we give you some tips, and we help you to organize the information, and we also give you some specific tools that you can use to look for these institutions, and we help you to tailor a specific submission plan for you to have like the best institution. After that, we also help you to review the finance situation that you will need to cover. We don't provide scholarships as a network. I mean, Education USA is not here to give you scholarship, but we help you to find the ones that you need to finance your studies. We know this is a complicated topic because we know everything about the costs and the cost of living also in the United States, all of those things. So we help you to take into consideration all of the necessary things for you to discover the amounts that you need, and also the financial aid that you can get. So once that we have this, we help you to complete the application that you have to submit to these institutions in order to be admitted. It is very common that the universities ask you for essays, for example, personal essays, standardized tests, tests about your English level, and we help you to find a way to cover all of that. How you're going to be preparing for a GRE, for example, or for a TOEFL IBT, or what are the different tools that you have to study and prepare for these standardized tests. We also provide workshops where you can learn how to write the best essay possible for the institution that you want to get admitted in. And we also help you to review those essays, giving you our tips in order to improve them and make them outstand from other applications. Once that we do this, and once that you have sent your application, we just wait for a letter saying that you are admitted into one of those institutions. And once that you get that letter is when we help you to apply for the visa. Depending on the type of studies that you're going to be doing or the type of submission that you send, it's the type of visa that you are going to be requiring. It could be an F1 that is a student visa, or a J1, which is for exchanges. And well, we have close communication with different consulates in Mexico. So we can ask one of the persons that work in there to provide appropriate information about the process that you need to follow to apply for these specific visas. So we help you to prepare for the interview. We help you with the documents that you need, everything that you need. We will be there to advise what's the best for you. And finally, once that you have your visa, your admission letter, and once you are ready to go, we also help you to prepare for the departure. What are you going to need in order to study in the United States? What do you need to pack? What are the offices that you need to visit or that you need to go with at the very beginning of the program? What is the process that you can do, when you can leave, when you have to return, what things you can do, what to do once that you are there, if you need if you need health assistance, who do you need to go, and how are you going to get it? So we try to prepare you in advance for all of the different situations that you might face once that you are in the United States studying your program. And well, even though you're there, we're going to also be here. If you need any extra advice or if you need any extra information, we will be here to continue supporting you in the process. Okay? Well, so now you know Education USA is here for you. So you just need to reach your closest center and we will be very happy to help you into this process. Well, having said so, let's introduce our amazing panelists that we have with us today. Both come from the University of Notre Dame, Notre Dame in different areas. We have with us today Elizabeth Wood. She is she likes to be called Liz, and she's the director of the Master of Science in Global Health at the University of Notre Dame, and an associate professor of the practice. Dr. Wood has over a decade of experience working internationally and domestically in areas of nutrition, gender, equity, and maternal and child health, with significant experience in project design, implementation, training facilitation, and curriculum development. She also does monitoring and evaluation. Her research utilizes mixed methods, both quantitative and qualitative, in nature, and seeks to explain the complex system dynamics that affect health, including factors such as chronic and acute malnutrition, access to quality healthcare services, and gender dynamics within the household. Okay, so, well, she's going to be one of the panelists that is with us today. And we also have with us today Jocelyn Karenin, if I'm not wrong. She is a member of the Environmental Health Program team at the Hoosier Environmental Council, with primary responsibility for a statewide lead messaging campaign. Prior to her work at HEC, Jocelyn was a program manager for a lead hazard control technological study between the University of Notre Dame, IUPUI, Indiana Department of Health, and HUD. Jocelyn is a returned Peace Corps volunteer who served both in the environment and health sectors in Tanzania from 2014 to 2017. She holds a bachelor's degree in geography from Kai Poly Humboldt and a master's degree in global health from the University of Notre Dame. So she's going to be the one that is going to let you know all of the evidence that she has been able to witness during her process an alumnus from Notre Dame. In addition, she is an EPA licensed lead risk assessor and inspector. Jocelyn's professional interests include environmental health, policy sustainability, and healthy housing. In her free time, she enjoys walking her dog, reading books from her local library, and textile crafts. So, thank you very much for being here, both Jocelyn and Elizabeth. Liz, if you prefer to be called that way. We're very happy to have you here with us. And we know the information that you're going to provide is going to be really, really important for our audience. So, before we start with the panel, guys, I want you to know that you can also ask your own questions. You just have to type them on the chat and direct them to Q&A Jenny Diaz. So she's the one that is going to be collecting all of the questions that you may have. So if something arises while we are discussing this topic, you can send your question and we will address all of them at the end of the session. And well, our panelists, both Liz and Jocelyn, are going to answer all of the questions that you may have. Okay, so well, thank you again. So let's go straight to this. Global health, it's something that maybe for us in Mexico, it's, well, in Mexico and I think in Latin America, is not that common. We tend to have like very specific ideas about the type of career paths that you can follow once that you study this. Can you please share with us examples of the diverse career paths within this field, especially for individuals without a medical degree, because that's something that for most of us in Latin America and Mexico, we believe that we need it, and what roles can contribute significantly to global health outcomes.
Okay, so thank you for the invitation. Thank you for having me. Without a medical degree, the nice thing about the Masters of Science, the MS in Global Health, it's called, and they may call it different things at different places, even here in the United States. I call it a terminal degree, which means it's very similar to like an MBA, where that's what you need to be a professional. So you can have an MSGH, as a Master's of Science in Global Health, and be a working professional. No one expects you to get a PhD. No one expects you to get a medical degree or anything else. You are considered a working professional with the MSGH. So what that means in terms of career outlooks and career trajectory, for me, there's a saying in the United States called Jack of all trades. It means you do a lot of different things. And then the second part of that phrase that I think people forget, in a master of none. So I say that a lot to describe myself. I'm a jack of all trades, but a master of none, which means that I do a lot of little things. In other words, in my introduction, I work in maternal and child health. I work with infectious diseases like diarrheal diseases. I work in just so many different topic areas in health and global health, but I'm not an expert in any of them. I have skills. I was taught skills, and within the MSGH program, you're taught skills, and we transfer those skills between topic areas. So I bring that up within this question because it allows you to change careers as, the market changes, as needs change. After COVID-19, we needed a lot of public health people. So it allows you that flexibility and adaptability to switch careers. But it also helps you too if you get bored. If you want to explore policy, if you want to explore like what Joe did in environmental health, or there's just epidemiology, biostatistics. There's so many areas of global health that you get trained in within the program that you're technically qualified to shift career paths. So I'll stop there to allow Joe, if she has anything else to add to that.
Thanks, Liz. Yeah, I think that was a great way to summarize. Jack of all trades is a great example. If you are interested in looking at specific areas you're interested in, I think it helps to get connected to either a government organization or a nonprofit organization, and then use your skills that way. So how I got into the environmental health space was actually I got trained as a licensed risk assessor, and my job paid for me to be trained as that licensed risk assessor. And now I have more information about how to prevent lead poisoning in the community for the children I'm working with. So sometimes it's those certifications that help on top of your degree program. So you'll maybe get a master's or something, and then you need to find a specialty, but oftentimes the job you work with will pay for that specialty. And I also think it's kind of a ladder you want to go in. So don't mind looking at jobs that are slightly community health worker jobs or other things like that, because you guys will gain skills that are in the field that program managers might not necessarily have. And because you have that unique understanding, it'll open you up to more positions, either administratively or managing programs in the future. But definitely, I think it's worthwhile to look at different specialties you can go into after a degree, and then go from there, because that will really look good when you're applying for other positions. So always keep the door open. If it's not the right fit at the right time, that doesn't mean it's not going to lead to another opportunity later. And connections are very huge in the global health space, for sure. It's a really, once you know people and they know you do good work, then more people are going to work with you in the future.
I would completely agree with that. And I know the world is big, but it is so small. When you start working in global health, especially in, like, Joe works in lead, and I've worked in, different areas of maternal and child health and whatnot. So you start to meet and see the same people again and again at conferences or applying to grants or in different spaces. You see them again and again. So it always helps to collaborate and make friends everywhere you go, because you, like Joe said, you want to make sure that you always do hard work, because that way they remember and they call you and they say, do you want to work on this project? Do you want to go to Mexico? Do you want to go to Panama? Do you want to go to insert country? And that way you always have that door open.
Great to know, and very interesting. So talking about this, if you can choose like many different areas to work in once you finish, what else is there for, or what is there for international students that want to pursue a career in global health? I mean, do they have to follow any educational paths or programs? Do you recommend anyone in specific before applying to the master's degree in this area?
So I always say no. I have a global health and a public health background. No, I have worked in admissions for global health and public health programs. No, I have had people, and what I mean no is I've had people from accounting, from business, from veterinary medicine, from pharmacy, from anthropology, psychology. So like the list goes on and on and on, from architecture, all over the spectrum of different degrees and backgrounds. We have people that come back to get degrees. People will go off to medical school, they'll practice for a few years, but then they decide they want to do something different. They want to do more population level work rather than individual clinical work. And they'll come to our program, and then they totally shift what they do. I have a lot of friends who have done that, who the first part of their life, they were medical professionals, and the second part of their life, they've been doing research with me all over the world. And so, no, you don't have to have any sort of background. And that's the beautiful thing about global health, is it's so interdisciplinary.
Yeah, and I think one of the skills a lot of you are already bringing to the table, at least something I noticed that's sought after, is Spanish speaking, especially within Indiana's context. So I am less on the research side and more on the community health side, so working with community members and grassroots. And sometimes there's a lot of hard to reach populations with different public health messaging. And the people we work with are either they have a unique connection to the community, or they also speak another language and are able to help kind of bridge that gap between the services. And that's always sought after in the public health or global health space, for sure, multiple languages, but also just they call these soft skills. I don't like that as much, but it's the ability to form relationships with people, because a lot of it is building trust. So it goes off that networking for jobs, but also networking in your community and being successful with letting people know you're a person that's trustworthy and they can go to when they have questions.
Very interesting. And yeah, well, networking, we know that nowadays that's one of the most important things that we should build. So yeah, great to know that global health is going to help you to build that network in all of the different areas that you may think of. Thank you. Well, let's talk a little bit about community engagement. Beyond traditional roles, how can individuals engage with communities and contribute to global health initiatives at the grassroots level?
Liz, are you going to look at me to that one? Okay.
Yep.
So we talked about lead poisoning a little bit. We have a grassroots lead messaging campaign, and that works with the NAACP. They're a group that primarily works with minority populations. So people who identify as African American are one of the largest groups that they work in. And then we also work with minority health coalitions. And they're groups that engage with people who are either Spanish as their first language, or they are working in vulnerable communities as well. So this has been a really great opportunity to see how policy impacts people at the local level, because we can change policies, but if people aren't hearing these policies, it's not making a big difference for them. And so working in the grassroots level, really, there were a few nonprofits that were working in this space before, and the Indiana Department of Health came and approached us because they knew that we had those connections in the community and would be a great space to work in. So that's just one example of a project. So far, the project has reached, it's been going for 6 months, and we've already reached 7,000 people with information about the importance of lead testing. So once those families get that information, we then connect them to doctors or their local health department, so they know where to get lead tested and can be protected from the adverse effects of lead poisoning, which is really nice. And just to add on to that a little bit, how I think if you are in school and doing a master's degree or whatever, I got connected initially because I did community-based research, and I stayed in the same area once I was done with the grad program. So I was actually doing HIV work here locally in South Bend, and the healthcare system knew me from my work on HIV. And so that's how I got into community-based research. And then other public health stuff as well. So that's just to say, I think working in the lab is awesome, but when you do those community-based research and see those projects in the field, that's when those connections are really made.
And I'll add to that, my experience coming from Florida. There's a city called Tarpon Springs, which is very close to Tampa, if you're familiar. And a few years ago, this was long before COVID, there was a bunch of retired teachers and principals of schools for, young children. And they noticed that there was a lot of students that were dropping out, and they didn't know why. And so they did more investigating, and they saw that it was drug use, and drug use was leading to incarceration. So they were leaving school and then ending up in jail or prison. And so it was through this group, they ended up calling themselves Peace for Tarpon. And they reached out to us. I was at the University of Florida at the time, and we worked with this group. It was, again, the very definition of grassroots organizations, where it was people that lived in these communities. They saw a problem, and it was just through connections that we got involved. It was like a friend of a friend of a friend who knew someone who was one of these teachers. So through that connection, we helped them write grants, and they got them. And then we helped them do all sorts of different, investigating what works, what doesn't work. And they did this really great study. They led it, and it had to do with the number one way to prevent a student from dropping out due to drug use and going to prison was a mentor. If they just had a mentor in school, then that could have helped them and stopped that path. So they started this whole program to develop mentors. So anyway, that was just another example from my early days of public health, where working in communities and listening to people in the communities. This summer I was in the Chiapas, and the same thing. We saw the same thing, where it was this small community group and this woman who had so much energy, who was leading it in different communities. And it had to do with, I think there was some sort of mining going on, and there was a lot of stuff, flowing downriver, and it was harming them. And they were seeing a lot more cancer, a lot of poor health outcomes as a consequence. And this is in your backyard. This is in Mexico. This is in your community, where people are fighting for their rights and for their health.
Yeah, amazing. So very interesting what you're sharing with us. Also, great impact, the one that this field can have in different areas. One of the mottos, to call it in a way, that we were using to promote this event was that if you want you don't need a medical degree in order to save the world. There are many different ways, and here the examples that you're sharing can make us realize that it's true. So thank you. Pretty informative and very interesting. So thank you. Well, let's talk also a little bit more about the challenges that the global health sector face. Right now, what are the current challenges in this sector, and how can individuals contribute to overcome these challenges? What's your opinion? Or also, what opportunities do you see emerging in this field, in global health?
As far as challenges go, I think it's very easy to do global health wrong. It's very easy to go into a community, any community, whether it's here in my neighborhood or in South Bend, anywhere in the United States and anywhere internationally, to go into a community and assume that you know what they need, and assume that you know more than them, assume that you can do, what's right, and you know how to fix it. So that is one of the biggest mistakes I've seen people make, and waste so much time and waste so much money, millions of dollars, and just because they simply didn't ask the community and work with the community. And I know Joe and I are both really community focused, but you have to be to be successful. But I think there are people that sometimes forget that. And so sometimes they go into global health or public health, and they think that, we teach this white savior complex, how they think that they're going to be a savior and save everyone, when people don't need saving. They need, perhaps listen to them or work with them. And fortunately, I think if there was a good thing to come out of COVID, I think it showed us that people internationally can do the work, because initially what would happen is we would get a grant, and then I would have students in the United States go off somewhere and do data collection. Whereas I think COVID taught us that no, people in Africa, people in any country, any continent can do their own data collection. And so I think it's helped it's helped push high-income countries like the United States, at least, to work with instead of over other countries. So it's forced that collaboration, and I hope that continues so that it's more equitable. So in that, I think there's opportunities for collaboration and partnership and working together to solve complex problems, rather than us coming from high-income countries and forcing our solutions onto other places and people.
Yeah, I can only second that, Liz. Collaboration is key. I don't work as much in the global health space, but I do work with across a lot of different entities, whether it's governments, nonprofit, or academic. And a lot of grants nowadays are looking for collaboration between two entities. And I think that's really important for multiple reasons. Liz mentioned a lot. We don't want to do stuff to people. We want to do stuff with people. But then it's also making sure that organizations are coordinating their efforts. So you don't suddenly have 5 different organizations that are saying, we're addressing malaria in this region. We're all giving out bed nets, and there's no conversation between the two. So trying to avoid duplicating the efforts that are going on and making sure that they're complementary, and not really taking the place of, let's say, Tanzania already has a bed net distribution going on through their government. We don't want to duplicate what they're doing, but maybe we can provide some additional assistance that they would request. So providing outreach around the importance of sleeping under a bed net, or listening to people why they don't want to sleep under a bed net, and then giving that information back to those individuals, and then they can think of best practices from there.
Great. How important is what you just mentioned, that this needs to be work with the people. I mean, this is something that you need to listen to people that is in the community and work with them, not over them. Yeah, because I think that's a problem that is easy to face in many different situations. Once that we believe that we know what other people need, instead of listening to what they really need and what they can do and how we can help them improve in their situations. So yeah, great. And well, now you're talking a lot also about collaboration. How do you think that international students will leverage these collaboration opportunities to enhance the impact that they could have in the global health, with global health initiatives?
So I think one unique thing, and I know this is one of your questions about Notre Dame, we're trying to shift the way that we teach students capstone. Capstone is this field experience. It's a practical experience within the program. Every student has to do it. I'm working with a student right now from Ghana, and she's an applicant. She's not in our program yet, but one of the questions she has had with me, and we've had several conversations about it, is she's a midwife. And so she wants to she works at a clinic in Ghana. So she wants to get the MSGH degree. She wants her capstone, and she wants all of her work. The whole reason she's getting this degree is to take it back to this clinic and implement what she learns. And so she has, unfortunately, we see this a lot in public and global health, where there's just so many problems that need fixing and need help. And she was just mentioning a few of them. And so one of the things we discussed was, we could use her role in this clinic, her partnership within the clinic, and have her capstone within the program be centered around that, instead of creating something, instead of putting her somewhere else working on tuberculosis or, something else in global health. We can actually have her work where she's already working and have an impact there, which I don't think that model has been done yet, where a student has come in and had their own proposed research project that impacts their own life and their own employment. So, I mean, that's one unique way. That's a very, very, I think, rare case as far as, my background goes. But it's a really interesting case that I'm really excited, should she get accepted into the program, I would be excited to pursue it with her.
Yeah, unfortunately, I don't have as much to add as Liz does. I do say if you are looking at a master's degree and are looking at different universities, see what grants they've applied for and have received and who the big players are funding them. So that's a great way to know how well connected they are to the international community. And those are connections that you'll be able to make at the university when you're there, and definitely take advantage of those opportunities. Invite people out for coffee, see what you can learn. The more you can network, the better. I feel like we're the two things is collaboration and networking.
And well, also very amazing that to know that you are open to create something that hasn't been done before, right? Even though it's a particular case that you are interested, so that also reflects how this field, how global health makes you see things differently from out of the box, right? Great. Well, so now that you're talking about universities, let's focus a little bit on, not a little bit, a lot, in Notre Dame. Tell us what are some of the features and unique aspects of this program in Notre Dame.
So I think Joe kind of said it, but I'm going to reinforce it, because this is, again, I'm coming from Florida. And while Florida is a really big university, and they bring in a lot of people, but when I started at Notre Dame about a year and a half ago, I was really blown away at a few things. So a few things that stuck out to me were the opportunities for students to network. And it's not, how do I put this? When students meet some of these pioneers, these leaders in global health, they treat you like an equal. They don't treat you like a student. They don't talk down to you. It's just this really nice, refreshing way to approach people, because I'm not used to that. So students get all of these opportunities. Tomorrow, they're having breakfast with a guest speaker from who's done all this, again, research in malaria all over the world, and by all accounts is a leader in his field, and he's having breakfast with a bunch of 20-year-olds, which to me is so great. And it's a nice opportunity for them. And so that happens quite a bit. We get a lot of people that come to Notre Dame because it has notoriety, I think. So there's politicians that come to Notre Dame. There's scientists. There's community leaders. We just hosted a panel for maternal and child health local leaders throughout Indiana. So anyway, there's that connection that I noticed. And the second thing I noticed about the program, and this may be too specific, but I've never seen a program emphasize ethics as much as this one. And again, I come from a public health background, so you would think that ethics would be embedded in it, but it wasn't. And so coming here and seeing that it was its own course, and to see it's a thread that goes through every course, everything that they do, everything that we do at Notre Dame, that was something else that really struck me when I came here. And I can't help but talk about it because I really appreciated it.
Gosh, Liz, you did such a great job of demonstrating. I graduated from the program that Liz did, and that was so wonderful to make those connections with leaders in the global health field. And it's exactly as she said, it's a sit-down conversation. If Notre Dame does something really well, they are amazing hosts. And if you like food, the food is always great at Notre Dame. So much so that we had an opportunity to do a conference a lead conference, and I knew Notre Dame would be able to host it. So we invited people from the state level to come to this conference with Notre Dame, because I know they would be great at welcoming people to that space.
Thank you. So just some examples of the great things that you're going to find if you decide to go to Notre Dame to pursue this global health master's degree. So thank you for letting us know. Well, it is time to listen from our audience. So Jenny is going to take the lead from now. She's going to share with you the questions that our audience has for you. Thank you.
Thank you, Edith, and Liz and Jocelyn. This has been a great conversation. I've been listening here. So I have a couple of questions from students who joined tonight. One of this is, what are some examples of research or projects that you're working on? And if you would be interested in having international students join into these projects, and how can they join?
So currently, there's a few. I just came back from Ethiopia this summer. So I'm working in maternal and child health. We're trying to get grants together for that. Right now, I'm just writing a lot of papers and trying to find grants. But that has to do with environmental exposures. We're trying to look at how climate change is impacting the use of pesticides. And then those pesticides leach into water that then women, and I'm specifically working with pregnant women, so vulnerable populations, then consume. And so it's a very specific kind of project. There's also a project that before this, I was literally writing it up right now, because we're trying here locally to work on something called a pop-up village. And it's based off of something that was done in San Francisco in California, where we get all of these resources together for, again, different types of populations to help address different health needs. In the state of Indiana, maternal mortality, so women who die after childbirth, is within around 100 days. That's considered maternal mortality. It's very high. Infant mortality, the number of children that die after childbirth, is very high. And so like we rank pretty poorly compared to the other 50 states. So we think it has to do with access to healthcare, with availability, with quality of healthcare, with systemic racism, with underlying racism, structure, like there's just, I can go on and on. So we're trying to get that launched in the spring when it's not snowing. It's not snowing now, but it will soon. But so there's a few projects going on, but again, I mainly focus around women's health, reproductive health, and then nutrition and gender norms and all of that. Climate change and environmental health kind of intersect with that. But as far as international students go, there's, again, if there's ever a project or a need within your area, within your space, we are always looking to collaborate. Like if not me, I work with a whole bunch of faculty, and not only do I engage in research, but I engage in humanitarian work and service work. I've worked with a friend from South Sudan. I have never set foot in South Sudan, nor do I think I should. But I've helped him develop a bunch of different stuff using apps to track patient intake at his clinic in one of the refugee camps. Anyway, I'm talking too long. But yes, there's always opportunities to engage, but that's just a little bit about what I'm doing.
Yeah, we aren't so much on the research space, so I think Liz has probably highlighted the best there. If you guys do come to do work in, get a degree in Indiana at Notre Dame or something like that, Hoosier Environmental Council does look for internships and opportunities like those. So keep that in mind for future opportunities in Indiana.
That's amazing. And those are really amazing projects and good projects that students can join and work with and learn more about it, right? And I think this leads me to the other question that we had. one of them was asking, like, when you were talking, this question came when you all were talking about not being, like, not assuming what the community needs and asking those hard questions. So this was like, how can we start asking the right questions without being too invasive to a community if we're interested in working with them, right? So I don't know if any of you would like to share your experience.
Well, Joe talked about trust. So I think, and I've had a weird experience in research. I never thought I would go into research. I would consider myself more practice-based or development related. So when initially started working in Haiti, I worked in Haiti for a long time. And so I developed relationships, friendships. We were growing people along with different projects. So a man who started out as my driver, by the last time I went to Haiti was in 2018, he was the project manager. And so I think you have to, it's not something that happens quickly. Trust, you have to earn it. You have to show that you're invested in communities, because again, we teach these things called helicopter researchers, where they swirl in, they get data, and then they swirl out, and they go and they publish, and they get all of this recognition, and those findings never end up back in the community. There's never an impact. And so yeah, I'll stop talking because I know Joe probably has much more.
Yeah, I feel I cut my teeth in the public health and global health space on community health needs assessments. So for Peace Corps, one of the first things they ask that you do is your 3 months in your community is you're not doing anything, you're just talking to community members. So you have 2 goals. One, you're assessing what they're asking for and are interested in working on projects. And the second goal is identifying a host country national, so someone who lives in the village who can continue that work once you're done and can kind of be that advocate. And that's really helpful because that helps build that trust in the community. From the local level here in Indiana, if you guys ever end up working for a healthcare system, especially a nonprofit healthcare system, they all have to do what's called a community health needs assessment, and that's done every 3 years. And that's when the public health system goes out and they're surveying the community, whether they're talking to key stakeholders, so organizations that might provide services for the community, or they're talking to community members directly and asking them what they want to be addressed. And I feel a lot of that's a great way to get familiar with what health priorities are pretty common in a community, but also really start building those relationships in the community as well. So if you were looking at a hospital after a master's degree, I highly recommend that, because that's a great opportunity to look at, get a sense of the health issues locally.
Yeah, that's wonderful. And I love the part where you mentioned that finding someone in the community who would continue the work that you started, because then it's not like you just go and everything is stopped, right? There is people in the community, and those people that you make connections with who are going to continue working on the projects that you all started. And so hopefully for students who decide to join the global health programs, we'll find a project who motivates them and then can, of course, learn and come back to change whatever is needed to change in where they are working. So Edith, are you around? I think those are the couple of questions that I got during this session. But as I mentioned at the beginning, we're going to be sharing this session. And if you can share your contact information, we'll refer those students to you.
Yeah, thank you. Thank you very much, Elizabeth and Jocelyn. This was pretty informative. It's amazing to see all of the things that can be done once that you join the Global Health Program. And thank you very much for accepting being contacted after this session. We're going to be sharing this information with more people, and probably we're going to continue asking you to join us in different sessions. Jenny, thank you very much. I don't know if you want to add something.
No, thank you, Jocelyn Elizabeth and the University of Notre Dame for this amazing session. As we say, it's an amazing resource that we have for students who are interested in global health. And the conversations we had were great and pretty informative for us as well as advisors, right? So thank you.
Thank you for the invitation.
Thanks, this was great.
Well, and remember, if you want more information, you can send us a message, you can send us an email, you can contact us through social media. We are everywhere. So if you also want information from Notre Dame and their programs and the global health programs that they offer, don't hesitate to contact us. We have some information also for you. And if you want to write directly to them, perfect. Okay. Well, thank you very much for having been with us today. And we'll continue enjoying this international education. Bye-bye. See you next time.